welcome to this month's edition of The Pulse. Gary Paxson with you here today. And joining me today is a very special guest. This is Jalesa Reed and her son. My pleasure. It's a pleasure to meet you. And Jalesa's son, Michael, is 5 years old and was recently selected as the Leukemia Boy of the Year. Yes. And so we're pleased to visit with you. I know we've been providing some services during this trial in your life, but it's a pleasure to meet you and be able to support you in a unique way. And so I guess why don't you start by telling us a little bit about Michael's journey, when he was diagnosed and what's going on.
So right before Michael turned 4, he had been covered in bruises, and as a teacher that was a red flag. I thought when I take him to the doctor, they're really going to be concerned about, why does he have so many bruises, what's going on, and it didn't seem to be getting any better. And we had a 1-month-old at home, so we were watching for fevers, and it never felt like he was getting any better. And Jalesa Reed, who is my husband's aunt, and she's an APRN here for WRHS Medical Center, and she sent us to Children's, and she said, let's just go in and see if he may be anemic.
Sure. See
if they can tell you right then, you know. And I go back and ask her if she knew, like if she knew something was wrong that day. And she swears she didn't. But within 3 hours, they had told us he had leukemia.
Oh my. And
his body was 88% full.
Oh,
so
wow.
They said within 2 to 3 weeks, we'd have been too late.
Oh my.
And
wow.
From that, we went upstairs from the ER. We stayed there a week, and we haven't stopped spinning since.
Oh
so,
my. Yeah.
But he hit remission after 29 days. And as an adult, when you hit remission, that normally means things slow down. You don't have to go as much. That's not the case for a child.
Yeah.
He takes chemo every night.
Oh
some nights he takes 2 or 3 chemos. He goes to Children's once a month, and then he also comes to White River Labs once a month for bi-weekly labs that they send on down to Children's to his doctor.
All right. Wow.
So this is a lot. It's a busy schedule.
I'm sure it is, but we're excited at least that, you know, sometimes those instincts that something's quite not right, but that great story that we caught it.
Yes.
As we were talking before this, you'd mentioned that there's kind of there's a light at the end of the tunnel. There's a date you're reaching towards. So
you have to do about 6 to 8 months of treatment, and then they give you your end date. And Michael's last day of treatment is February 5th, 2021.
Wonderful.
So that's going to be a big day.
That will be a big day. We will have to help you celebrate.
We will. He's excited to ring the bell. They have the bell right there when you leave. And every time he's like, is it my turn? I'm like, Bud, you have no idea how long it will be, but your time is coming.
Understood.
We will ring the bell for however long he wants to.
You bet. That'll be fun. That'll be fun. So one practical way that we get to help you and your family is we have a benefit dinner coming up.
Yes.
April 25th, and it'll be here on our campus in the conference center.
We're so excited.
Oh, it's a pleasure for us to be able to extend that to you. And so tell us a little bit about what you hope and goals out of that.
Yes. So we're running for, I guess we aren't. I'm running for Woman of the Year, and as a candidate, my goal is to raise X amount of money, and of course the winner is determined by who raises the most money.
Sure.
So I'm competing against 3 other ladies, and I'm the only one from a small town.
Oh, okay.
So I'm the underdog.
There you go.
I'm coming in as the underdog. I know I am. I get it. But I'm hoping that they have a gala in May, but I'm hoping that White River's dinner can be something that all those people who can't come to Little Rock in the middle of the week in May, they can come out. White River's growing, just since Michael's been diagnosed to now. And so it'll give them a chance to see our facility, see what Michael does when we're not at Children's. These are his primary caregivers right here. So visit with him. Hopefully he'll be a little more interactive than he was when you guys met him a second ago. And eat a good dinner. We're going to have some pies auctioned off.
Wonderful.
And all the proceeds are going to go straight to the campaign. So I'm hoping that'll help this underdog
You bet.
Come in at least like a good solid number. So
you bet. Well, we got a big audience, so we'll help start a grassroots movement with you.
Yes.
But Before we leave, why don't you tell us? Obviously, you are a mother and you have another daughter, and one more on the way.
We have a baby coming on the way. Yeah, in August. So we'll be a family of 5. My husband and I both teach at Southside.
Oh, wonderful.
He's from Concord, and I graduated, from Southside. Lived in Batesville all my life. So that truly, that's what's carried us through the campaign. And even before that, when Michael was diagnosed, I mean, it wasn't work. Like, I was on maternity leave, and I'm also hormonal right now anyway, so I'm real sorry that my voice is cracking. But
okay.
Instinct was, what are we going to do?
Sure.
Then it kind of came into, how are we going to pay for these things? And those bills come in before you're sure. I mean, in this little town of just 10,000, I mean, there were times that they helped keep the lights on.
Yeah.
And because I wasn't working, they're like, it's okay, y'all can go to work as long as you don't work with little kids. We're both school teachers, so I was like, okay, but so when they said, well, do you think your community will support you? I said, absolutely. I said, this town, they take care of their people.
Yeah.
So, but yeah, we're all 5 of us. We're just the underdogs, and so we're going with that.
That is a strength of our town, and our strength.
It is.
The passion of even our employees here is that you are our neighbor, friends, loved ones, and so we're happy to be able to make your acquaintance. Sorry it was in this era, but we're glad to be able to serve and support you in this way, and so
it gets the word out.
Yeah.
It takes bad things to make good things happen.
You bet. Jalesa, it was a pleasure to meet you. Everyone, please remember April 25th. We'll be putting information out about tickets, but come and support worthy cause and take care of Michael and your family. But thank you for spending some time with us today. It was a pleasure. Our pleasure. Our pleasure. Employees of the month for the month of April. For Stone County Medical Center, Margot Del Real from Stone County has been employed with us for 3 years. She was selected for outstanding work ethic and willingness to help others. Margot, congratulations. We appreciate you being part of the team. And at White River Medical Center, Richard Clark. Richard's been with us for 29 years in the Information Systems Department. Richard was nominated for prompt service. Richard, we really appreciate all your years of service, the value that you bring to us, and congratulations to you both for being nominated. In the area of news, April 27th, we'll be holding our annual fishing tournament at Norfolk Lake. And if you're interested, Bobby Littleton can give you more information, but it'll be on the 27th from 6 a.m. to 2 p.m. We encourage you to participate in that. April 22nd, we'll be launching the second version of the Employee Engagement Survey. This time it's going to come out digitally. It's just as confidential as the paper method was. It'll be open for a couple of weeks till May 13th. Really encourage you to participate. Let your voice be heard and help us craft what we can do to focus on making this a better place for you as employees. We're going to do our first ever hernia screenings. We'll be taking appointments very soon. Great opportunity for us to reach out to our community and screen for this important issue, and so keep your eye out for that. June 3rd, our VOLUNTEEN program will be relaunched, and so summer's not that far away from us. If you have a student that you know of from 9th to 12th grade who might be interested in this program, they can apply. It's a 6-week program. Toy McMullen can get you more information about that. Great opportunity to do that. Deadline to apply is May 12th, and so reach out to Toy if that's of interest to you. Last, I really want to thank the 1,144 employees who stopped by at our forums over the last few weeks. Great time. Appreciate the feedback and the energy that was in the audience. It was a great time to connect with you. Hope you find it to be of value, and we'll continue to do that. But I just want to thank you for coming out. Thanks for watching this month. Hope you have a great month, and we'll visit with you again soon. Thanks.